Hi, everyone. Tonight, it's all about the thyroid. And why is thyroid health the devil that neither you nor your doctor really knows about?
Well, I think the devil's in the details. And with the thyroid, there's a lot of nitty gritty involved. And today, I can't wait to dig in. We're going to go ahead and get started, everybody. Here we go.
Hi, everyone. Thank you for joining us for Transform Table Talk Live. I'm Anna Manuel alongside Dr. Maggie Yu. And you want to talk all about thyroid today because really, and even if you don't realize it, thyroid is something that impacts all of us. I cannot tell you how many people in the program are shocked to learn they have thyroid issues.
It really is. And, it's interesting and we're going to get into it. But we actually asked our Facebook group last week and this week some questions about what were their biggest frustrations about their thyroid and what were their biggest questions. And let's just say it was lit. And we had thousands of comments between YouTube, LinkedIn, Instagram, and Facebook. So we have a ton of questions that have come in and we're going to be answering them today. First thing first, if you're watching right now, if you're an alumni of any of our Transform programs, type in chat. Tell us which program you did, what year you graduated, where you're watching from. Tell us what some of the major health obstacles you've overcome. Put it in chat. If you're watching us, anybody else and everybody else, tell me more about what's going on with you. Obviously, today's show is all about the thyroid. Do you have some big feedback, obstacles, frustrations about your thyroid? Put it in chat. I want to hear it because we're watching it and we're going to be answering some questions live today. And we're going to be doing a lot of talking about the thyroid.
Yeah, I'll be watching the chat closely. So if you do have questions or comments, put them in, type them in. I'll be sure to pop them up and we'll try to have Dr. Maggie and another top doc who we will introduce momentarily here answer the question for you. Maggie, should we bring her on in?
Yeah, we're going to bring, before we bring Kathy on, though, I wanted to let you guys know that Dr. Jason Bradley was going to be joining us live today, and he was really looking forward to it. He does have a family emergency today. So we're going to be making up to you and him because he's been super excited about this. Mm-hmm. So he will be here next week. Okay. Same bat time, same bat channel next week. And there's going to be a part 2 of this. And because I know there's a lot he wanted to say and talk to you guys about. So we're going to be breaking this into 2 parts. So without further ado, I'd love to bring Kathy, one of our certified Transform instructors in. Kathy, I'd love for you to introduce yourself.
Hello, Dr. Maggie. Hello, Anne. I'm Kathy. I am a registered holistic nutritionist. I've been working with Dr. Maggie since 2019. And I love talking about all things hormones, all things thyroid, all things digestion, all those good things. So I'm excited to see what we've got in store for tonight.
We don't have Dr. Jason here who's always like, I love to talk all about poop.
I leave the poop topics for Dr. today. That's his area of specialty, maybe.
I love it. I love it. We've got a ton of alumni jumping in. Agnes is watching from Pennsylvania. Emma Info Dumps. Alumni is watching from Washington. Emma, you're in Washington? I didn't know that. And then Loretta coming in from Oregon. Which part of Oregon? I know you're in Oregon, Loretta. I was wondering which part it was. And the rest of you that are watching, let's have you tell me what is one of your biggest thyroid frustrations or questions. Put in chat right now. That'd be really awesome. Hashimoto's turned around with Transform. I love it. And then the rest of the people are like, what is Hashimoto's? Which we're going to talk about. First of all, we're going to go ahead and get started, everybody. All right. Sheridan in Transform program now, watching from Texas. I love it. And Sheridan, tell everybody what you're overcoming. Oh, hi, Victoria. Great to see you. California. I love it. We're Australian people. Canada, come on in. Ireland, Dublin, come on in. All right, everybody.
Well, we have some of our first comments too coming in about thyroid, and John says weight gain.
Yeah. Before we get started, and people coming in, goiters, nodules, I want to actually just do a general conversation about what is the thyroid. Why is it so important? Why do I call it like the devil that you don't know? And why there's so much, the devil is in the details about the thyroid. Okay. So everybody, I am a functional medicine physician, which means that I started my career as a family medicine doctor. I got very, very sick to the point where multiple times I could have not been here now. What I learned later was that my early menopause, fibromyalgia, neuropathy, TMJ, weight gain, hair loss had everything to do with my thyroid, which no one discovered, even with multiple postpartum depressive episodes, weight gain, hair loss. So, as a physician myself and as a treating physician later, these problems with the thyroid is commonly missed, as in my story. And it wasn't until the age of 38 that I actually discovered that I had an underlying autoimmune disorder called Hashimoto's, okay, which is an autoimmune attack against my thyroid. What is the thyroid? Okay. And I'm going to ask you guys, if you had to write one sentence on what the thyroid is or what it does, can you guys type in chat? What do you guys think the thyroid does? What is the thyroid? What do you guys think it does? This, the size of the thyroid, literally the size of like a walnut around your neck. It's not big. Okay. It's literally right here, like a little butterfly right over your neck. Okay. And the thyroid is a hormone making organ. It makes hormones. Okay. So it makes, yes, thyroid hormones, right? And interestingly, this is not the only organ involved in your thyroid, because thyroid hormones, even though your thyroid makes it, there are multiple other steps after the hormone is made, which is inactive, that it becomes further downstream processed, turned into other hormones that are eventually active, that requires other organs in your body to cooperate with that. Okay, so there's many steps that actually, from your brain to your thyroid, from thyroid to your body parts, and then to activation, and then around your body, every single cell in your body, and I mean every single cell, has a thyroid hormone receptor there. So a thyroid hormone will float around. There's a receptor sitting on, this is, let's say, a cell in your eyeball or your hair follicle. Thyroid molecule actually will go to that receptor, and it's like turns on the cell, right? Turns on the metabolism of the cell, turns on the energy making, turns on the ability of the cell to do whatever its function is supposed to be, turns on its ability to utilize the energy to repair, heal, live. So how important do you guys think the thyroid is as a hormone making organ? And how important do you guys think thyroid hormone is, right?
Huge, huge. It impacts, as we're seeing, so many aspects of our body.
It really does. And the other thing is, the thyroid makes hormones, but that's not the only organ in your body that makes hormones. What other organs, and I'm going to ask you guys, makes hormones, right? We know from participants in my hormone masterclass in our main program, you have other hormone making organs like what, right? Your ovaries, your adrenals. Your ovaries make your sex hormones. Testes in the male makes male sex hormones. Adrenal hormones, which is another hormone for metabolism, mental well-being, another hormone that's involved in your nervous system. And then we also have hormone making cells in your pancreas that makes hormones like insulin. We have other blood sugar hormones like glucagon, right? And then we have thyroid hormones, and we have brain hormones. Like, there are hormones literally, and there's hormones all over your gut doing a lot of functions. And they all work together. They all work together. So I think of the thyroid almost like a spider with 8 legs and webs that go throughout your entire body. Really.
Creepy crawly.
It's really an important part and a connected tissue of your of many, like, think about it. It's critical part of the ecosystem. It has a lot of functions. Like, all these fine little threads are really thin and almost invisible, but yet it critically connects to all the other parts of our body and has a lot of function. It's a beautiful organ, but yet, because it is involved in so many body systems, the symptoms can be immense.
And I just want to highlight this comment from Emma, because it rings true for so many people who have worked with you, Dr. Maggie. She says, I had no idea I had low production of the thyroid until I did the program. No one ever checked my thyroid. And I'll add to that, even if your doctor has checked your thyroid, they might have said, oh, you're fine, because maybe they were checking a certain aspect of thyroid that wasn't necessarily.
Agreed. And when you look at the big picture, I'm a root cause medicine doctor, right? Functional medicine doctor. So imagine, like, the root causes, the major root causes of any chronic health symptom, and you're taking a cross section of the trunk of a tree near the root, right? And you got to take a look. And you guys have seen me talk about how hormone balance is this big wedge over here on the left. But this plays a critical role into gut health, which is why, like, when you look at the thyroid and gut are really nice next to each other, intricately linked. It's related with blood sugar because there are blood sugar hormones, right? And because of the thyroid's connection with the gut, it really impacts a lot with the nutrient density, digestion, all these vitamins that are getting absorbed and utilized. And then we're going to talk more about how thyroid and nutrition and food can be related as well. So there are a lot of pieces to this. And as someone alluded to, there's a lot of steps in thyroid hormone metabolism as well. I don't want to complicate the matter, but I want to let you guys know that there are at least 10 steps that are needed to get your thyroid from brain signal says I need more thyroid hormone all the way to the end tissue where it gets activated, the lock and key turns on, and your hair follicle says, I'm going to keep making more hair, right? So there's a lot of steps that are involved.
Mm-hmm. Mm-hmm.
Yeah, and I think that's the key here, right? Is that because just the way you were talking about how the thyroid affects every function in our body, when it's not working properly and we have all these different symptoms that seemingly are unrelated, and we're going to, I don't want to get into all the symptoms yet because I know you're going to talk about that, but when we have all these seemingly unrelated symptoms and we're going to all these different experts, who is actually looking at the thyroid? Who's looking at the thyroid, right? Which expert is looking at the thyroid when you've got this multitude of seemingly unrelated symptoms?
Well, I know a lot of people have mentioned that they don't know who to go, which doctor should they go to get their thyroid, and it seems no matter which doctor they go to check on their thyroid, they're not getting the right testing, the right understanding, any root cause approach to it, or any results. So we're going to talk about why in a bit, but I want to first, let's dig into this because the top question in the group and the top number one question in the world about the thyroid is, what are the signs and symptoms of low thyroid? Okay. And we're going to make this a game and I'm going to have everybody in chat get ready. Okay. We're going to call it Capture the Spider. Okay. Imagine each of your finger is one leg of a spider. Okay. And I'm just going to read off some of the, at first, common symptoms of low thyroid, and then I'm going to get into some of the more uncommon symptoms. When you get to capture at least eight, you've captured the spider, and I want you to write spider in chat, okay? And then the other thing is that at any time, if there's a symptom that you're hearing that you had no idea was even related to the thyroid, think about, make a mental note, even write it down, what that symptom is, and then put it in chat. Because you'd be shocked how many of the people don't realize that these other symptoms are really also common, right? The uncommon is actually really common. So we're going to go ahead and get started with a spider game. Capture the spider, everybody. So imagine and start going with your fingers right now. I want to see who's going to read spider first. It might be when I get to number 8 already. But number 1, fatigue. How many of you are tired? And I'm not just talking about physically tired, but what about brain tired?
Yeah.
Right? Number 1, how many people have chronic fatigue? And how many people have something called chronic fatigue syndrome? Or that you're told that even months after something, like I was 8 months postpartum and I was exhausted and I was told that's just normal. You just had a baby 8 months ago. Fatigue, okay? Number 2, weight gain or difficulty losing weight. How many of you look at grass and feel like you gain weight, right? That's the kind of stubborn weight gain that I'm talking about. Kathy's like, I know what you're saying.
Well, I don't know. I just have to say, I don't look at grass and gain weight. I look at ice cream and gain weight. I look at cookies and gain weight. Grass is not really a problem for me, but I don't know. Maybe that's a problem for you, Dr.
For people with low thyroid, the feeling is I could just look at the grass outside and I'm gaining weight. That's the kind of weight gain I'm talking about. So that's number 2, right? Number 3, we're talking about cold intolerance. How many of you have cold hands, cold feet? You feel cold all the time. Everybody else doesn't. How many of you have icicle feet in the bed, right? Just saying. I'm still going right now. Number 4, dry skin and hair. How many people have really dry hair, scalp, dry skin, right? You have eczema, right? Number 5 still revolves around the hair. How many of you losing hair or have periods where you really shed a ton of hair, or you look in the bathtub and there's all this hair all the time and you look at it and it freaks you out, right? You know something is wrong, right? That is not normal. And another thing is mental health changes, whether it's periods of depression, anxiety, brain fog, poor focus, ADD, ADHD, right? You name it. How many are on that list, right? Number 7, memory. How many people struggle with memory and really have problems with concentration? You feel like you're floating, can't concentrate, you're thinking about the grocery list, whatever, everything else while you're trying to focus on something, right? And then heart and blood pressure. How many people notice that their heart rate is slower? Or interestingly, how many people have fluctuating heart rate where it goes fast and slow, fast and slow, fast and slow? How many people feel the heart skip? How many of you can feel that? We call that palpitations. So it's not just slow heart. In fact, the most common symptom I see is palpitations or even tachycardia, which is fast heart rate, which is why people with POTS, dysautonomia, with that fast, slow heart rate thing, oftentimes, almost 90% of the time, have a thyroid issue underneath. And
You
we're
have
gonna
a spider, by the way. People are starting to get the spider now with eight of your symptoms
we're
already.
at number 8 and we're already at 8. Oh my gosh. Agnes. Gabby. I love it. Okay. Great, right? And we're not even halfway there. Think about this. What about constipation? And it's not just constipation. How many of you have alternating diarrhea in constipation? How many of you have severe heartburn? Right? How many? I mean, seriously, right? How many of you feel like food takes a while to move, right? As if it's stuck, right? How many of you swallowing problems?
Yes. Yeah.
Trouble swallowing. What about hoarseness in your voice? These are low thyroid symptoms, right? Puffy face. What about muscle aches, body aches, right? How many people muscles feel just weak, right? It's weaker than it used to be. You go to the gym, you try to do the same exercise, but you're weaker and you don't recover as quickly. How many has that happened? And then how many people had infertility and struggles with pregnancy, right? Thyroid, okay? And then neuropathy, nerve problems. How many people have nerve problems, right? Pain in your nerves, numbness and tingling, burning, right? And then last but not least, these are the most common. This is a really common thing. How many of you guys have thyroid goiter, nodules, cysts, and cancer?
Yep.
By the way, do you guys know how many times people have thyroid cancer and haven't even been told that they have a thyroid problem? Oh, you just have thyroid cancer, but you don't have a thyroid problem, right? There we go. We got a ton of spiders here, right?
There are spiders crawling everywhere. There's lots of them.
Right? So I just want to show you guys just how big of a web that this thyroid is really a spider throughout an entire body. And was there any like symptom that really shocked you, right? Or were you ever told that with these symptoms, how many of you with spiders or with many of these symptoms was told your labs were normal and you don't have a thyroid problem?
Yeah.
Worse yet, was told you don't have a thyroid problem. Okay.
Or how many people have been diagnosed with another chronic condition like fibromyalgia, and it's actually a thyroid condition, that an undiagnosed thyroid condition.
Ooh, you're making me okay. So we have a ton of alumni. Heather's raising her hand. I love it. But like think about this. In the program, this happens all the time. We deal with people with all sorts of every autoimmune disease on the planet. We have people with POTS, mast cell activation syndrome. Those of you with POTS or dysautonomia, where you have the heart and slow heart rate, positional change, you feel dizzy and faint, right? And you got the blood pressure changes. I can't tell you how many times I've had someone come into our program, Transform Fundamentals program, to find out that their thyroid, their TSH was normal, but when they actually got the comprehensive thyroid panel with us and they actually learned about it, their thyroid was completely in the shitter. Like shitter. I'm talking about, I don't even know how this person is walking. How many of these POTS and dysautonomia patients are actually hidden thyroid problems?
Mm-hmm. So many. I mean, the comments are coming in faster right now than I can even keep up with because everybody's saying yes, 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 yes.
Yep.
Right. And it's not, I mean, and I think about it too. I mean, the association between thyroid and other diseases is so high that it's rare for me to see someone, for example, like who's a diabetic or someone who has rheumatoid arthritis or someone who says I have the C word, long haul. Someone says I have chronic Lyme, chronic fatigue, I have neuropathy, who doesn't have a thyroid problem. Mm-hmm. So I'm going to list a medical reason why this happens. Okay. So how many of you guys, like all of you guys have said that you had normal thyroid labs? Well, did you know that the only thyroid test that's needed, quote unquote, by all the endocrine medical official societies is a test called TSH? Okay. And did you know that TSH alone is completely, wholly inadequate and inaccurate way to diagnose thyroid disorders? Okay. It is not even actually a thyroid hormone. It's not made by the thyroid. It's made by your brain. It's not even a measurement of one of your thyroid hormones. It's just what your brain thinks is going on. Anyone who has a brain that's confused already? Could it be confused about your thyroid? all the freaking time. So all these places are saying, just do a TSH, not even a thyroid hormone. It's a thyroid stimulating hormone made by the brain. And we're going to use that one test to diagnose whether you have low thyroid or not. And I'll even tell you right now, currently in the United States, what they find is at least 10% of the population have a condition we call subclinical hypothyroid. Do you guys know what subclinical hypothyroid is? It means that by our labs, everything is normal, which by the way is just a TSH, but yet the person displays at least a spider full of symptoms or more. So they have low thyroid, but it's subclinical, meaning that our clinical testing can identify it. That's 10% of the population. Depending on the study you read, it's anywhere 4%, 10%. In my experience with people coming in with any symptom, it's more like at least 50 to 80% of people who, let's say they weren't even diagnosed with thyroid. When they come in, and I'm going to ask Kathy that, and I'm going to ask Anne, because when she went through the program, how many people, and I'm going to ask alumni, Nicole, okay, everybody who's an alumni in chat, how many people was told that they had normal thyroid, but then when they came in and they learned about all these steps of the thyroid, did the comprehensive thyroid panel and troubleshooted their thyroidist, found out they actually had real low thyroid, and not just real low thyroid, really shitty thyroid. And what happened with you?
Yeah, and I wasn't the only one. There were so many of us. I would say you're accurate with your probably more like 70 to 80% of the people.
Yeah.
Like going through the program. It was almost surprising to see somebody who had great thyroid numbers at some point, because there were so many of us dealing with this. And, you know, I had been tested for many years. My thyroid, my TSH always looked great.
Mine too.
When I did the comprehensive panel, you pointed out to me very clearly, no, your thyroid is low, and we can tell it, and then we can match your symptoms up to it, and it all makes sense. So yes, and my story is not unique. This happens time and time again.
Yeah. Kathy, what do you feel like you see? I mean, we go over thyroid labs all the time in our programs. I mean, to me, it's an epidemic.
Yeah, I would agree with Anne's assessment that it's probably 70 to 80% of people that go through the program, because like she said, when we actually don't have anything to talk about with someone's thyroid, that's actually very rare. It's like when we actually see all the numbers are great, it doesn't happen very often. I'll just say that.
No. And then I was even told that at one point I had a thyroid, nodule? And nobody cared. They were like, no big deal. We'll just watch and wait. Or actually, you don't even really need to come back. And I'm like, you told me, what are we waiting for? Are we waiting for you to get cancer?
Well, so I'm going to tell you guys right now, those of you who are watching right now, we have a comprehensive thyroid guide that we developed, and also a 6-part training all about the thyroid of previous thyroid trainings that I've already done. So if you want the thyroid guide and training series, just put thyroid guide in chat, and a member of our team will reach out to you and give it to you, because I've talked about thyroid goiters, nodules, and cysts. So yeah, start popping chat with thyroid guide. I'm seeing it coming in everywhere. Thank you. So we have a thyroid guide, 6-part training. Put thyroid guide in chat. That'll be really great. Now, here's the other thing is that why do our thyroid get thyroid nodules, goiters, and cysts? I know all the alumni know the answer, but I want everybody to guess. Why do you think thyroids would create? Your thyroid gland here looks like a pretty little butterfly. Why does it start getting all the lumpies and bumpies?
Mm-hmm.
Does anyone know why it gets all lumpy and bumpy? There's a reason for it.
For them to answer. So you'll start seeing the answers pop up, but a couple people are typing in their thoughts now.
Some people think it's a lack of iodine.
Iodine. Okay, that's
Nope.
one suggestion.
Nope. Right? So I wanted to point out something, okay? So
here we go.
The alumni are coming in.
What do you think about Loretta?
Loretta says autoimmune attack. All right, we're going to talk about this for a second. Let me pop this up on the screen, everybody. So did you know, okay, the thyroid, just the thyroid, little butterfly here, has 6,000 targets of autoimmune attack. 6,000, okay? So it's not just like 1, 2, or 3, okay? So did you know that most laboratories, you know, even the best laboratory on the planet, has only 11 of the targets that's testable by blood, and most laboratories only offer 2 to 3 targets of autoimmune attack testing. So here's the interesting thing. How many of you guys had a TSH, never even had autoimmune testing done, those 3 tests? And you're just told your thyroid is normal with your TSH. You don't have an autoimmune issue going on with your thyroid because we didn't even bother testing for it, or we tested those 3 labs and you were negative. I'm going to ask you something. What are the odds with all the symptoms of low thyroid? You got the full spider going, right? And your TSH is normal, right? And you test 3 out of 6,000 targets. What are the chances that you don't have an autoimmune attack of your thyroid going on when only 3 out of the 6,000 targets are even tested, right? So with only, I mean, seriously, less than 1% of the targets tested, they tell you you don't have any problem with your thyroid. And in fact, you don't have an autoimmune attack against your thyroid. What this tells you is even if you had the autoimmune testing done, right? And you tested, even if you had the autoimmune testing done, that doesn't mean you don't have an autoimmune disease of your thyroid. In fact, did you know, I'm going to tell you guys right now, all of you that have low thyroid, latest studies, 90% of you have autoimmune related low thyroid. Regardless of whether you tested positive or if you even had those 3 tests done on those 3 targets, most, at least 90% of people with diagnosed low thyroid have autoimmune disease of the thyroid. So what does this tell you guys? How likely is low thyroid an autoimmune disease?
How likely?
At least 90%.
Pretty likely. Yeah.
Well, and I'm going to ask this. How many of you have either diagnosed low thyroid or you already know you have low thyroid? You already have another autoimmune disease.
Mm-hmm.
Okay. And I'm going to talk about why this happens. Why is there such a strong association between autoimmune disease and people with low thyroid? Okay. What is autoimmune disease? Autoimmune disease is your immune system. Think about this. We have an immune system with, different branches of the military. They're here to, what do? They're here to look at somebody that's outside your body as a germ and say, I'm going to kill you. You're a germ. You don't belong in here, right? Immune system, one branch. Another branch will look inside your body and see cancer cells. And it says, you don't belong here. I'm going to fight you. So another branch of your system, immune system, is there to actually fight cancer as well, right? So a healthy immune system is supposed to be having these healthy functions of fighting cancer, fighting germs, reacting to some allergens that it sees it doesn't belong in the blood. That's what a healthy immune system is supposed to do. In any autoimmune disease, whether it's rheumatoid arthritis, Sjogren's, lupus, you name it, okay, Hashimoto's of the thyroid, your body looks at a part of your body and says, you're a germ and I'm going to kill you. Well, your thyroid cell is not a germ, but it looks at it and it thinks it is, and it's attacking it to kill it, okay? So if 90% of people with low thyroid is actually their immune system attacking their thyroid and trying to kill it, I'm going to ask you guys something, right? What's the likelihood the same immune system starts making mistakes and starts attacking many different body parts? Do you think any of you that have an autoimmune disease have just one target that's being mistaken as a germ and being under attack? Or do you think it's hundreds, more and more and more? Do you think that people with one autoimmune disease, what's their likelihood of getting 2, 3, 4, 5, more and more autoimmune disease diagnosed over time?
Yeah.
Huge. How many people more than one autoimmune disease? Type it in chat. How many of you have a known autoimmune disease have low thyroid and have never even been told that your thyroid problem is autoimmune linked? It's being destroyed by your own immune system, right? Jill says, I have 4 autoimmune diseases, right? Is this gonna be a spider game again? Tell me how many autoimmune diseases you have. Type it in chat. And tell me if you also have low thyroid as symptoms or diagnosis with it. This is really common. And for me, this is a travesty that more of you don't know it. And here's the problem, okay? And we're going to go to the doctor side of it. And Kathy's in Canada, right? And this isn't just a United States problem. This is an international, global problem. This is why our programs are global and international. But if the expert on the thyroid, who treats thyroid? Most of the people with low thyroid are treated by primary practitioners, family practitioners like I used to be, right? Or they're being treated by endocrinologists, medical doctor as well, right? And none of these doctors, whether they're primary care doctor, family practitioner, or endocrinologist, have any training around an autoimmune attack of the thyroid. They're only trained on how to use the TSH, only the TSH, to adjust the dose of thyroid medication if you need it. That's the only skill that they have.
The interesting thing is I feel like what every doctor does is I mean, most of them don't even test anything more than the TSH. But even if you do go to an endocrinologist and they do test some of these other things, all they do is they look down the line, see what your numbers is. Oh, is it showing up on the lab report as high or low or out of range? And that's all. And it's like, no, everything's in range. You're good. Thank you. And that's it. That's it.
Well,
That's
and
as much as we get.
Well, and here's the other issue. I also see people going to naturopaths or functional medicine doctors to quote unquote get their thyroid checked, right? And yes, there are absolutely bigger lab panels that should be done and not just TSH, right? But here's the issue too is that if you want to get the thyroid guide to learn more about this, put thyroid guide in chat. I think it's really critical that people get, number one, the right thyroid test, and it's way more than TSH, right? There's certain parts of T4 that should be tested. There's T3 that should be tested. There's also autoimmune labs that should be tested. But my most important thing is not even just what labs, it's what's the pattern the labs are showing. Which part is the dysfunction happening? I go even deeper because I'm like, okay, what are the optimal levels of these labs that your doctors never do, number one, right? And we do it in our programs. What are the optimal numbers for them for you to not have those symptoms, right? For your cells to function properly, for your cells to actually be lock and key turned on, right? What is the optimal level for that? But I also think about, okay, if this number is this and this number is this number is this and that number is that, and you have these other symptoms, what is this pattern? What is the real cause of this person's problem? Right? I
There's
remember
the superpower. You're always able to spot these patterns, Dr. Maggie, and get to the root cause of why these issues are happening.
you have to. And this is why we call, when you say, what is it? I call it the thyroid, the devil you don't know, right?
Yeah.
I can tell you 100% of clients coming to work with us on their thyroid, whether it's in our main program or in our new upcoming program, whenever someone works with us on our thyroid, it's like this huge eye opener, and they realize just how big of a devil this whole problem really is, and how much ignorance there's out there, and how much people have to battle their doctors. They actually have to fight their doctors to actually get the right labs, the right understanding of the root cause, and the right treatment, right? And what I find is, even if you're seeing a naturopath or functional medicine doctor, that doesn't necessarily mean you're going to get the right labs, and that doesn't mean you're going to get root cause training at all.
Mm-hmm.
Number 4, it doesn't necessarily tell you exactly what can I do to calm an autoimmune attack.
Yeah.
Is your naturopath, a functional medicine doctor, or any of your primary care or endocrinologist an autoimmune expert? And the answer is no. Thyroid is an autoimmune problem, but none of these people are trained in dealing with autoimmune issues. They're trained in one little thing, and it can't be all about, I need more iodine. Is that really the right solution for people with autoimmune thyroid? Right? Mm-hmm. But there's also the way that naturopathic physicians are also trained. It's pretty old school, but everybody used to be trained in naturopathic medicine, throw iodine in every person with low thyroid. We now know scientifically that's not the right thing to do, right? So what's a scientific approach to get the right tests, right? And what is a scientific approach to look at your data, your patterns, and the training you need to calm the attack? How do you calm the attack that's the root cause? And nobody's doing it. I mean, it's really nobody out there from a medical standpoint is really doing this work. So that to me is the biggest frustration. And I hear it all over the group. I mean, people said, Jill says she's fighting insurance, right? Mm-hmm. Somebody else is saying my doctor won't order the test. And I run into this problem too, where people think, like thyroid medication. Is thyroid medication bad? I'm going to ask this question to everybody here, okay? Mm-hmm. Is thyroid medication bad? Is it the enemy? Is it the problem? Right? I'm curious, right? Type it in chat, because I've had many people being told by a naturopathic physician or a functional medicine physician that they don't believe in thyroid medication. Yeah. They don't believe in it, right? And that therefore you don't need it, meaning turning around your thyroid naturally means that even if you're on a ton of thyroid medication, you need to stop the thyroid medication. It's the evil. It's the devil. Is thyroid medication the devil?
And we're getting answers across the board. Some say no. Some say yes, it's a Band-Aid. Some say maybe because if it's synthetic. back to no. They're saying some can be. So Dr. Maggie, I think we want to hear you weigh in on this. What are your thoughts on taking thyroid medication?
Well, and here's the thing. Look at Kathy. Kathy is a registered nutritionist, right? And I'm an MD, right, with all the holistic training around this, and I am an autoimmune and a hormone expert, right? And I am not anti-medication. We have one of the biggest groups on natural medicine and how to use natural medicine for you. But that doesn't mean I'm anti-medication, especially when it's needed or life-saving, right? So absolutely, some people must be on thyroid medication because so much of their thyroid gland has been destroyed by the autoimmune attack. It is something is dead on the thyroid. It's not coming back. So it's the same to me as someone who surgically had a thyroid removed. And then you say, oh, thyroid medication is evil. So what? We're going to remove your thyroid because it has cancer, then you're going to die? Does that make any sense? Right? So we literally have something medical that's happening, an autoimmune attack against the thyroid that's killing thyroid cells. And then we say, oh, we can't give you any thyroid medication because thyroid medication is bad. It's not. It's just one of the tools.
And just because you're taking thyroid medication, Dr. Maggie and Kathy as well, that doesn't mean that you can't still simultaneously take steps to improve your thyroid function naturally and to calm the autoimmune attack all at the same time, right?
And that's exactly where I was going to go, Anne, because the other thing is that we have tools that can make your medicine work better, right?
Mm-hmm.
That's the other thing, is that if you're only getting medicine from your doctor with no other instruction around the best way to use that medicine, other things that you can take, or lifestyle habits even that you can adopt so that your medicine works better, then there, once again, you're only getting a small piece of the puzzle.
Very small. And then Dr. Maggie as well. I know your entire program covers this, but specifically, I know you'll discuss this in detail, and you have, but there are so many ways that you can work on calming the autoimmune attack as well.
Well, it's true. So for me, like, this is why I'm just going to put it out right out there right now early. For the first time, we're going to be launching. A lot of people have asked, why can't we work with you on our thyroid? Why can't we work with you on the thyroid? And the answer is yes, you can. For the first time, and right now, only time, we're going to be launching. We are currently launching My Thyroid Masterclass. That's going to be starting in April.
This is big. This is really big because so many people have been asking you for this, and now you've developed an entire program just for thyroid to work with you and the other top docs in your program directly on what's going on with their thyroid, diagnosing the problem if there is one, which there probably is, and then seeking out all of the ways to address it. That's huge. Can you give us more details about what this program will entail?
Yeah. So for me, like, really importantly is everybody who's been through our program to know how important education is. But the first thing is the right data. And I see a lot of questions here around testing. Well, I'm going to go ahead and let you guys know that in my thyroid masterclass, I call it 4 months to total thyroid transformation. You're going to be working with me and our team for 4 months. We're going to have a comprehensive test kit. That's a blood spot test that's going to be mailed to your home. And this is international. We have clients all over the world. We can send the exact testing and the complete testing that you need for your thyroid to you internationally. Number two, there are expert video modules to learn all different aspects of thyroid health. Think about this as a master's degree, right? And I love playing full out. Kathy loves playing full out, and Dr. Jason. It's really important to take your data, your history, and your symptoms and present it to us and ask us questions live. So we get to put it all together because every single case is unique. Okay. Every single case is unique. So what I find is, let's say Jill's case is going to be different than Agnes's case. It's going to be different than Loretta and Mary Beth's case, because the things that's fueling one person's low thyroid is very different from another. There are a lot of different components to it, right? So it's really important in thyroid. You don't want to go through something general that's not personalized to you. Okay. People want to know, well, how should my thyroid medication dose be adjusted? Should I even be on thyroid medication? Should I get off thyroid medication? Or, oh, I'm staying on thyroid medication. What can I do to help my thyroid medication get lower or stay low, right? Like, those are all really important skills that nobody is teaching, right? And most important yet, How can I reorder my thyroid test if I need to anytime that I want without having to beg a rock to hug me back over and over again, right? How do we get really powerful with your ability to order your own tests, your ability to understand those test results, your ability to access us to review those test results, your ability to see these patterns play out in all different people, all different age groups, all different patterns, right? And how do I make all these connections of thyroid with my digestion? What's going on with my food with it? And is it impacting on my hormones? How is it going with my autoimmune disease? What can I do to calm my underlying autoimmune attack? These are big. And so for me, this is a master's in transforming and turning around your thyroid, working live with us based on your own data, your own personal history, and your own learning. So this is my thyroid masterclass, and we are just starting. You guys, this is the first time we've announced it. You could look at that code, and that will bring you to a page to give you more information about it. I'm really excited about this because it's the first time we're doing this, and I'm interested to see, because over the years we've had thousands of people ask us to do a thyroid program, and to work with us with on their thyroid, because people in our Transform Fundamental program have benefited so much. Like thyroid, I always said thyroid is such a big part of this. It's really hard for me to make it into its own separate program. Well, we finally did. We took the giant piece of thyroid and how it spider webs and connect with the other pieces, and we have put it into one program, which is the My Thyroid Masterclass. And so the other piece is that the other piece is, I know some of you said you wanted to get the guide, and I promise you're going to get the guide. If you want the thyroid guide, that's free with all the trainings that I've previously done on the thyroid. It's a 6-part training series, free. This code, just scan it with your phone. We'll guide you over there. Just get my free thyroid guide. Look at some of my trainings in the past. Do I make sense? Is it helpful? Does it relate to you? And don't take it from me. Tons of other people share their experience and their big ahas in the training series. So I really want to make sure that you watch it. And then the other thing is that when you're in doubt, because we have a lot of different programs in Transform, we have My Hormone Masterclass focusing on the sex and adrenal hormones. We have My Food Mapping focusing on digestion and food allergies. We now have a new program launching right now, which is My Thyroid Masterclass. So if you're in doubt and you're like, can I pick 1 or 2 or 3 of these? Can I do the main thing? Which one should I do? Book a call with our team. We don't know what you need until you tell us, but I am telling you that this program has been in huge demand. And for the first time, we're launching it. We're starting to enroll right now, and the program starts in April.
Thank you for not only providing this class, but that free guide, and for addressing how people can get more information, because we are getting so many comments coming in right now. People are very interested, have specific questions. If you have a specific question about what's right for you, that's the best route, Dr. Maggie, right? Just go ahead and book a call with the team. They'll answer all of your questions.
Now, we did mention that some people, I promised that we were going to go back to the goiter situation. Okay. And I want to talk about what thyroid goiters, nodules, and cysts were. Okay. I'm going to show you that with 100% certainty why this whole autoimmune issue makes me lit, and it should make you lit. The only reason anybody has any goiters, nodules, cysts, or even thyroid cancer is because the cells are under autoimmune attack. Can I get a boom in chat with that one? Okay. How many people have had any of these or all of these and have never been told that you have an autoimmune disease?
Yes, me. I have, as I mentioned, I have had nodules for years and no one ever mentioned it to me ever. And I've had to fight to get ultrasounds done because they thought it wasn't a big deal.
Right. And so this is why I'm letting you guys know right now is that your cells in your thyroid, normally they should be normal functioning thyroid cells. But when your cells are under attack constantly by this autoimmune attack, your own immune system attacking it, it tries to protect itself by enlarging, which would be a goiter, right? And certain areas will enlarge itself into little hard nodules. It's protection. And the other way that it will protect itself is forming a cyst, which is a wall with fluid in it, almost inflammatory fluid inside, because it's under attack. And when a cell is under constant attack all the time, the likelihood of it turning into thyroid cancer goes, do you know how much higher? People with autoimmune disease of the thyroid, do you know how much of a higher chance of thyroid cancer do they have than someone who doesn't have an autoimmune disease, right?
The number haunts me because you teach it to us in the program.
Yeah. What is the likelihood someone with low thyroid, which, we already know at least 90% is autoimmune. What's the likelihood of that person have an increased risk of thyroid cancer?
Yeah. Here's Kelly.
Kelly,
Kelly.
Kelly, Kelly. Hi, Kelly, I miss you.
Mhm.
10 times. Your chance is 10 times more likely to get thyroid cancer. So, when you have all these people with low thyroid that never even know that they have an autoimmune disease going on, they never even ask, the doctor never orders, or they never even know how to ask for a thyroid ultrasound to see if they have any of these. Goiters, nodules, and cysts are precancerous, right? How many people never even had a thyroid ultrasound with that? This isn't an autoimmune issue, and it's becoming a cancer issue because you're at 10 times higher risk.
And I
How
just
do you,
want to
right?
interject to say that I've seen in the program, once you've seen people's thyroid results, you recommend that they go get an ultrasound. And there have been occasions where that person comes back and says, oh my goodness, they caught what they think is now cancer, Dr. Maggie. And I would have never known about this had you not told me to go get the ultrasound.
So you're right. I mean, and this is why I think this is a really great live that we're doing here, because this is life saving. Low thyroid is not just low thyroid and no big deal. Low thyroid is an autoimmune disease left unchecked will create precancer and cancer cells and make more and more other autoimmune diseases. Boom.
It's information that is not only helpful, can not only make you feel better, but can save your life. That when I hear that, and it gets real. Then this could develop into cancer. You have a 10 times greater risk of getting cancer. And in fact, some people will find out, hopefully not, but that perhaps there's some suspicious things going on that could be cancer.
Yeah.
Mhm.
And I see Courtney talking about like being able to afford programs and all. One of the things I'm really proud of is that we used to only have one main program, which is our Transform Fundamentals program that covers every single part of the wheel that we had talked about. So if someone feels that they have a big problem, they need a big solution, they need every single piece, we had a program, right? Transform Fundamentals that covered everything. And it is, and people kept asking us, oh, I can't afford that program, or not right now. Can I get started with another piece, or can I do one of the programs? Or I don't have all the problems. Maybe I have just one of the problems. I love the idea that we are branching into more and more and more smaller programs designed to help people get started earlier and quicker, because the sooner and earlier you intervene in thyroid, autoimmune disease, chronic disease of any type, the easier it is to actually get a permanent, fast, and bigger solution, right? So I love the idea that we have various programs for various price points, that all the way up to our main program. So there really is a wide range of pricing on our programs, and every single one of the programs have some sort of payment plan on it as well. So I do encourage you guys. There is a link here for my thyroid masterclass. That is a program specifically focused on thyroid, one major focus, and it's a 4 months total thyroid transformation. And there's even a payment plan on it. And I'm also going to encourage you guys that if you're really thinking about it and you're like wondering, can I do that with the food mapping? Can I start choosing things almost like an a la carte system? And the answer is yes, yes, and now yes. And are there payment plans that make it possible to do that? And the answer is also yes. So I love that flexibility that we have now, which is why I'm really excited about introducing more and more programs, right?
Mm-hmm.
Can I also say, I just want to really come back to the access to the thyroid test, because that's a huge problem. I live in Ontario, Canada, and if there's anyone else from Ontario, Canada, we cannot get these tests. Like, we just can't get them. And having the knowledge that I have now, because I was able to get that test, is life-changing. And there are so many people walking around that just don't even have access to the test. So this is a service that is not available everywhere, right? People can't just walk into their doctor and ask for a lot of these tests. So that's why I'm so excited about this program, because I know a lot of people in my area that are going to be flying here to because of the access to the test.
Well, not just access, and we offer the test just like we offer hormone testing in our store, and we'll put a link here to our thyroid collection as well. But we offer also at-home test kits for people to test their thyroid, independent of our programs. Okay, it's included in our programs, but if you're not in our programs and you want to order this test, and it's available internationally as well. So it's really important. Access to testing is important. Access to retesting. So one of the other things is for me is that when anybody goes through our hormone program, which is a year-long program, people go through a thyroid program, which is a 4-month program. I encourage people to give them a specific timeline of when to retest, so that, because it's important for them, because for me, data is really important, right? Data comes in 3 sets. The first set of data is your symptoms, which we just went over, right? Number 1, symptoms. Second set of data is your either blood spot results or your blood test results, is your actual laboratory data is number 2. Number 3 is your current medical history. If you told me you had diabetes and thyroid versus if you told me you had POTS and thyroid, my recommendations would be different. Okay, so all 3 of these pieces of data really go together comprehensively to tailor look at what your root causes are and how you can fix it. These things are really important. Your data really matters, and you got to listen to all 3 sets.
We're getting a lot of questions that are coming in, Dr. Maggie, and people, they're hungry for this information. And I just wonder if you might address, since we were talking about cancer, and that is such a topic that piques a lot of anxiety for people. This person wanted to know if they are dealing with goiters or nodules and they know they're at risk of cancer, your thought on going ahead and removing the thyroid?
This is the surgical approach to medicine that I abhor. Okay, which is why so many women get unnecessary hysterectomies. A lot of, I would say almost 90% of thyroid that get partially removed or removed are unnecessary. And the reason that it's unnecessary is if you don't stop the underlying autoimmune attack in the first place. So like, what is causing that problem? Think about it for a second, right? What is causing your thyroid to have the goiters, nodules, and cysts is there's an unchecked attack. Literally is an army attacking this gland, causing it to say, I'm going to protect myself, I'm going to protect myself, I'm going to protect myself. Now, without stopping the attack, which isn't just attacking your thyroid, it's attacking other body parts, we just say, you know what, we're going to remove the thyroid, your entire thyroid or part of it. And what does that do? That actually makes you more vulnerable to actually symptoms of low thyroid, because now you're completely dependent on a medication to try to balance your thyroid while you lose a gland. And you, by the way, you've done nothing to do anything about the autoimmune attack. The autoimmune attack army is still floating around your blood, trying to attack not just your thyroid. By the way, this is alumni will know this. If you have an autoimmune disease attacking your thyroid, which is a hormone-making organ, what's the likelihood that your female and male hormones, your adrenal hormones, your blood sugar balancing hormones are all sorts jacked up? What's the likelihood they're also under attack because they look identical to thyroid cells? Type it in chat.
And there was somebody, while people are answering that, I can't go back in the comments far enough because there have been so many come in on this, but somebody even said earlier, you know what, I had half my thyroid removed and I still have all of the unpleasant symptoms. It didn't do anything.
Well, doesn't that make total medical sense now? Think about this, everybody, okay? She had half her thyroid gland removed because they said, oh, there's a goiter there, it's precancerous. Oh, there's thyroid cancers there. Okay, great. They removed it. They've done nothing for the attack or the underlying cause of that problem. There's still thyroid left there. And even if there wasn't thyroid there, there's still that attack happening. That hasn't stopped. So what's going on here is she has the cancerous or precancerous stuff removed. There's a leftover thyroid here, still under attack. As the attack happens, depending on whether the attack is up or down, high thyroid symptoms, low thyroid symptoms, high thyroid symptoms, low thyroid symptoms. Burst of cells, repair temporarily. Some die, some repair. This is going on all the freaking time. How many of you have, you guys think of schizophrenic thyroid?
Yeah.
Your doctor says you have anxiety. You don't have anxiety? You have a schizophrenic thyroid. It's under autoimmune attack. Up and down, up and down, up and down, and it's responding appropriately to being hacked to death up and down all the time. It's not because you're crazy. There's a crazy ass attack on your thyroid.
Yeah. And that also goes back to managing the medication and helping it work better, because how many people can't get the right dosage for their medication
Right.
because their levels are constantly changing. We
Yes.
see that all the time.
All the time. And so to
Mhm.
answer your other question now, you were saying, what's the likelihood of other hormone making organs being under attack? Lots of answers coming in, and they all say the
Yes,
same
Cindy,
thing. There's Jody. Hi, Jody.
you guys are so smart. Thank you. Thank you. I mean, this is the thing is this is a master's degree. I mean, I will no doubt tell you. And Miss Craig was talking about when am I going to train medical professionals? We actually do. So we have had tons of medical professionals that have gone through our program. We have certified transform instructors like Kathy, who we have instructed with, and they teach exactly what we're talking about here, utilizing data, which is your labs, utilizing and understanding it's autoimmune, utilizing that food, nutrition, lifestyle, movement has a lot to do with it. And even your thoughts have a lot to do with how to turn around your thyroid, right? So I love that we're training you and medical professionals on how to deal with this. I love it.
And I just want to say too, you actually have so many medical professionals also come through your program.
Yeah.
They then are taking your teachings and passing them on. I interviewed an alumni just this week who is a nursing professor, and she says she utilizes your teachings and your case studies to teach the next generation of nurses. And I thought that was so amazing because how lucky are they to be getting that education?
Well, thank you very much. And I also had at one point had a functional doc who was a Hashimoto's expert, who came through our program, and she said, I learned a ton going through your program that I wasn't able to learn because I didn't go through medical school. I went to naturopathic school. And so she learned a ton because really, truly, I think you have to marry the two. You can't just say, I'm just a medical doctor or I'm just a holistic doctor. I think you have to put the two together to win this. You really do. And I'm in it to win it. And so that's why I say I take the best of both worlds, all my MD smarts, right? All my own physical issues with Hashimoto's and autoimmunity linked with this, and all the natural and holistic training, and put it together and present it as a master's program for you, so that anyone, everyone, anywhere can learn how to do this. Because I think it's really critical. This is a fight for our lives. This is a fight for the quality of our lives. And it's also hereditary. It impacts children and the generation above and below us. So to me, this is mission critical.
Yeah. And I love that about you. You are a doctor, but I think you also pride yourself in being an educator.
Yeah.
Truly. And this is an educational program. I mean, you'll learn so much that you'll be able to then apply to your life and the lives of other loved ones. And Maggie, we are getting so many questions that I know we've been talking for a while and you still have some time left, but I think we're going to need to talk about thyroid another week.
Yes. So how about this? All right. Because I know one of the biggest questions that people asked was about weight. A lot of you talked about weight. A lot of people talked about hair loss. I know Dr. Jason's favorite topic. And then
He's not here to defend himself.
And people are just like, why is my face so puffy? Because your thyroid sucks. Right? Because your thyroid sucks. Why am I so hoarse? Because your thyroid sucks, right? Why do I have, I mean, there's so many whys that are answered because of thyroid issues. And even somebody just asked, what does the thyroid do? Well, thyroid hormone actually, if you guys missed what the thyroid does in the beginning, I did a really good summary of it. So go back and watch the beginning of this video. But thyroid, you can think about it as an on-off switch for each cell for the ability of it to do what its job is supposed to be. So if that cell is to make energy, it needs a thyroid hormone to touch the receptor, turn it on, and it says, I'm going to make energy. If it's your gut cell doing digestion, it needs a thyroid receptor to hit it, turn it on, and says, I'm going to make stomach acid to digest. Every single function in your body of every single cell is 100% dependent on these thyroid numbers being exactly where it needs to be and in a pattern it's supposed to be.
Yeah.
Right.
Yeah.
So this is really important for you guys to understand.
And I'm not sure if this person wasn't here for the entire live, but they said, is that why? Because my numbers are all normal. And I would be willing to bet that if they look at the complete panel, maybe they're actually not normal.
Well, it's by the way, it's not just about the panel. Like we do this with hormones all the time. And so a lot of the hormone videos I've talked about how the docs will draw the blood or even look at saliva and just say, oh, that hormone is in that normal range. And I'm going to ask everybody in Hormone Masterclass and in the main program, how much of this isn't even about what the lab number is, and it's the relationship between this hormone to this hormone to this hormone to this hormone, and it's understanding what this hormone makes this hormone makes this hormone that makes this hormone. Where does that happen, and where did it go wrong? And then we say, boom, this is how you fix it, right? Like, that's the laser point that you have to understand these steps, and the laser point with which you can look at the pattern and not just the number. Is this number in the right range? Is to say what is and where is the problem, and that informs you on how you're going to fix it in you.
Huge, huge.
Right?
People are saying, yes, please do another session on this, because there's just so much to get into. Like, I know one of the top questions were, what are the best dietary lifestyle changes that we could have to support thyroid health? And that's a whole topic I know you could talk on for a long time.
Well, what I would love to do is, if there's enough of you, Kathy can, because I know Dr. Jason really wants to be back next week, and Kathy would love to be back speaking for you. But like, I think that if you guys are interested, next week we can have a live on thyroid. There's enough of you that are struggling with hair loss, energy and fatigue, weight. Type it in chat. If there's enough of you, we're going to do a second part 2 session on the thyroid to go into it more. I'd love to see if that's the case. And then the other thing is, I didn't get a chance to touch on supplementation. Okay. The guide has everything on supplementation. So if you want to put supplementation in the chat right now, we can get the guide to you, and go ahead and download the guide and the 6-part training that's associated with it. Because I've gone into supplementation in the past. I don't want to shortchange you. I want you to get it.
Mm-hmm.
So I want on our, how many of you are watching from YouTube? If you're watching from YouTube, can you write YouTube in chat? Or give me a hands up in chat and the YouTube chat, all the YouTubers. Oh, there you are, Nicole. I see YouTube coming in. Lisa Carpenter, Agnes. Oh, by the way, our YouTube channel just this past month headed over, I think, is it 20 or 24,000? My goal is by the end of March, I want to hit 30,000. And can I say 40? Come on, everybody. I would love for you to subscribe. Oh, thank you. All of you that are on YouTube right now, make sure you're subscribed. Do you know less than 10% of our watchers are actually subscribers? So if you can subscribe to our YouTube channel right now, give us a thumbs up, on this video. More people are going to see it. And ring the bell to get notified every time we go live, because this information, I'm just putting it out there. I want you to learn, right? And those of you who are not watching on YouTube, I could have our team put the chat to the YouTube link. Go to YouTube and give us a thumbs up on this video and subscribe to the channel.
Jane says you're going to hit 100,000. Just you wait.
Oh my gosh. I'm so tempted right now to go through supplementation. Do you guys want me to go through the too long, don't read down and dirty supplement version? Do you guys want supplementation that helps?
Yeah, I know they do, because people are begging for more. They're saying more, another session, please. So
okay, you guys have to go and subscribe to the channel before I put out. I'm just telling you that right now.
Wind and dine, people.
I see a link in chat. Go ahead and go to YouTube right now. Subscribe to the channel. If I can get 100 subscriptions right now, I'm going to go ahead and do the down and dirty right now. Back here on Thursdays. Boom, boom. Do you help hyperthyroid? The answer is yes. Hyperthyroid is the same problem. It's an autoimmune attack, but it's against a specific receptor on the thyroid that causes it to make more thyroid hormone. So it's the same problem. It's attacking just a different target on that thyroid, another one of those 6,000 targets. So the most important thing with people with Graves and hyperthyroid is to calm the autoimmune attack that's causing that to happen, right? And is there room for medication? Do some people need medication with that? Yes, as a life-saving measure for sure, but not everybody. Many people, if you discover Graves early, and many people, even with other types of low thyroid, initially will have high thyroid because so many cells are being destroyed and they're releasing so much thyroid hormone. So a lot of even later low thyroid in the early stages fluctuate a lot with high, low, another pattern that we teach and talk about. So just so you guys know, hyperthyroid, absolutely. High thyroid, 100%, it's autoimmune. There's not even a 90, it's 100. Mm-hmm. And many forms, most forms of low thyroid started out as high, low, because they're responding to the autoimmune attack in the first place. But there are people with permanently high thyroid as long as they have the autoimmune attack. There you go, right?
Yes.
All right.
People are talking, really wanting more information about the supplementation. Okay.
So I'm going to tell you one thing. Okay. I'm going to give you one thing, because there's only 85 of you who subscribe to the channel right now. I needed 100. Kathy's like, oh.
Forever the negotiator. Love it.
Come on, go subscribe to YouTube channel. We're at 86 right now. I feel like it's the Easter seals. Do you remember Easter seals, or am I dating myself, with Jerry Lewis? And there's all these phones in the back going, and they're like, we're hitting that number right now. 86, 87. All right, everybody. The most important thing everybody can do for their thyroid is Thyroid Protect cream. And the reason is it's a glutathione cream, very specific formulation recreated that actually absorbs from the skin straight into your thyroid. Glutathione has a really protective effect on each of the cells of your thyroid to kind of give it a little bit of an armor against the attack. So it can give it the ability to withstand the attack so the cells won't split as easily and get damaged or hurt, and less likelihood to get cancer as a result of it. So how easy is it? You don't have to swallow it. We don't have to worry about stomach digestion or anything. Take this cream, pea size, over your thyroid, once in the morning, once at night. We use this for prevention, prevention and protection against thyroid attack. We also use it for people with active goiters, nodules, and cysts, and even thyroid cancer. And believe it or not, we have tons, I'm talking hundreds of alumni who've had nodules, goiters, or cysts actually shrink in size within 6 months of utilizing this product. And that tells you just how effective it is at preventing thyroid cancer, right? And the thyroid attack, right? And then I'm going to go really quickly. Well, I'm not going to give you everything because the rest of it's in the guide. You guys better go click the link to get the thyroid guide as well. Jill loves Jerry Lewis. How many of you remember Jerry Lewis, right? I'm going to keep dating myself. I sang Laura Branigan the other night at one of our mastermind calls. And I'm like, how many people know Laura Branigan? And people are looking at me like, who? And I'm like, come on. And Paula G. I know who you are, Paula. Okay, let's put her comment up. Paula, and Paula, was it your nodules or goiters or cysts? Like literally, we have person after person talking about, because in the world of your endocrinologist and primary care doctor and even naturopaths, these thyroid goiters, nodules, and cysts don't go away because you know what? They're not doing anything to stop the attack. So they quote unquote monitor it to do a repeat ultrasound 6 months, a year. Why? To wait till it turns into cancer so they can do something about it. But so in their world, these things don't go away. So you'll have somebody like Paula. Paula says she had nodules. Come on, great job, YouTube. Paula's coming in from YouTube. She says she had nodules and goiters, and on this product, it went away. Remember, they're precancerous. You don't need a cure for cancer. You just prevented it. Thank you very much.
That's amazing.
Here on Thursdays.
Your doctors, your endocrinologists, they're not telling you that there's any chance of these going away. They don't give you any information.
In the world, it doesn't, though, Anne. If you don't know jack and you don't do jack about turning off the autoimmune attack, if you have no training on supplementation and you don't even understand what glutathione or a topical cream can do to protect the thyroid cell, why in your world would goiter, nodules, or cysts ever shrink?
Right.
Why is this fantasy world to them?
It is.
Right.
But it's not a fantasy for you.
Okay, I'm going to click one more supplement and then I'm going to leave you be because you're going to have to get it from the thyroid guide. Okay. If you want the thyroid guide, put that in chat. So the other supplement, selenium, really critical, is high dose selenium. I like to target towards about 400 micrograms a day. Okay. So, and the other way from a diet, a lot of people ask about dietary. And I'm gonna quiz the alumni. I'm gonna ask Kathy to share what's a dietary way for people to get some selenium.
Oh yeah,
go Kathy.
Do you want me to wait until we see some
response?
Gillian's already got it right there. Brazil nuts. Yeah, Brazil nuts contain enough selenium. If you have 4 Brazil nuts a day, contains enough selenium to be protective for the thyroid.
Oh, look at all the alumni weighing in. Yes.
Look at this.
Smart
people.
Jenny.
Yes.
Oh my gosh, there's so many OG people here from all our programs. This is like a high school reunion. This is like Maggie and Kathy's high school reunion.
And Kathy, can you repeat again because there's an upper limit for how many Brazil nuts you should eat, right? How many did you say you should be consuming if you're not allergic to Brazil nuts?
4.
Okay.
I mean, that's pretty standard.
Yeah.
Yeah.
Yep. There you go. Okay, everybody. Even when the supplementation went way over time, I hope that you guys enjoyed this. Biggest takeaway here: most thyroid is, well, all thyroid pretty much is autoimmune. Number two, getting adequate, comprehensive laboratory testing is critical. But the most important thing is getting yourself educated, so you understand what the underlying patterns are and how to stop an autoimmune attack against your thyroid. Period. Anything else? Did I miss anything?
No, that was really comprehensive, but I know that there's so much more to get into. So people are really looking forward to diving in. We're going to do this, you think, next week?
Mm-hmm.
Yep. So next week, I think we're looking at, might be the same bat time, same bat channel. We'll let you guys know. Stay tuned, everybody. But next week, we're going to be back. Dr. Jason's going to be back. Kathy's going to be back. And we're going to be talking all about thyroid. We're focusing on some really stubborn symptoms. I think we're going to talk about fatigue, hair loss, weight.
Ooh. Okay. There was somebody saying, please talk about weight. So yes, it's coming for you.
Okay. I think we are we wrapping up? Is that a wrap, everybody?
Kathy, thank you for your time and expertise today. And Dr. Maggie, thank you so much for creating this program, creating the guide, the supplementation guide, all of it. I know it's going to help a lot of people. So thank you for spending the time on this.
That's a wrap, everybody. Have a great day. See you guys next week.